Good afternoon and welcome to today's webinar brought to you by the Current Consulting Group and sponsored by Abbott. Today's webinar presentation is entitled Fit to Work, Fit to Win, How Occupational Health Services Can Be a Game Changer. I'd like to thank Abbott for sponsoring today's webinar presentation. At Abbott, we create life-changing technologies and products that help people live healthier, fuller lives. With a proven history under the established eScreen brand, Abbott is your trusted partner to deliver substance abuse testing and occupational health services that help you achieve a safe, healthy, and productive workplace. And so with that, we're going to keep moving forward, and we wanted to make sure that you guys are aware that today's presentation has pre-qualified for continuing education credits from HRCI and from SHRM for those who attend today's presentation in its entirety. Today's presentation will be brought to you by Bill Current, the president and founder of the Current Consulting Group. He is also the former vice president of consulting at Employee Information Services. He was the former executive director at the American Council for Drug Education and the former director of the Institute of a Drug-Free Workplace. He's authored 10 books on substance abuse prevention and drug testing, and he also sits on the board at INDASA. And so with that, we're going to go ahead and turn the microphone over to Bill to get us started today.
Okay, thank you very much, Jessica, and welcome everyone to today's webinar presentation. I just want to pause on this bio slide for a minute because as Jessica was reading that, it suddenly occurred to me that I've been in the drug testing business for over 36 years now. So somehow I got caught in this vortex and I haven't been able to find my way out. But I'm grateful for the career that I've had and for the many opportunities I've had over the years to work with Abbott. Jessica read a little bit about their background, but one of the premier brands in the employee screening industry with a very wide and diverse offering of screening services and products. And so as we go through today's presentation, there will be some times when I highlight Abbott's involvement in some of the things that we're going to talk about. And if you have questions over and beyond sort of the content, and this is the agenda that we're going to follow, but if you have questions over and beyond the content of today's presentation, you'd like to know more about what Abbott does and the services that they provide, we'll be able to plug you into that and make sure that you connect with the right person over at Abbott to help you to help answer your questions. So with that, let me get started. Now, we're going to talk about occupational health, and I'm going to share some general information, just make sure we're all on the same page, and then we'll go into some very specific things. I invite you to ask questions, submit questions through the question function or the chat function, either one, and we'll try to get to as many questions at the end as we can. I'll leave time for questions at the end. If there are any that we don't get to, we'll make sure that we send you a written response to your question, and we'll share it with the group. You'll also get, as Jessica mentioned, as an attendee, you'll get a link to the recording of today's presentation. So there may be some slides that I don't spend a lot of time on because they're really sort of background informational slides, but you'll have all of that information, and you'll find that in many cases, there's a link at the bottom of the slide, a URL or a website that you can go to find more information about it or where we got this information. So as we go through it, you don't have to take copious notes because you're going to get these slides, and then you'll be able to click on those URLs at the bottom or the sources. So let's just start out with the definition of occupational health. Now, this we got from the World Health Organization, WHO, and they define it, quote, as occupational health deals with all aspects of health and safety in the workplace and has a strong focus on primary prevention of hazards. Okay, and then you can see the asterisk there at the end, or the asterisk down there at the very bottom that tells you where we got that information. Now, worker health has lots of different determinants, okay? It can be risk factors in the workplace, accidents, physical well-being, the musculoskeletal element of the worker, respiratory circulatory diseases, hearing loss, stress-related disorders, and more. And you'll find all of that at the WHO website, okay? So I'm not going to go into all of it because it's a long list of things that they list there. We're going to talk about different types of employee screenings and tests that relate directly to certain aspects of an individual's physical health and well-being, their physical ability to do the job that you've hired them to do. And I also want to point out that as part of a of a really well-balanced program, I would definitely, and I'm going to spend a few slides talking about that, I would definitely refer you to the OSHA website, the Occupational Safety and Health Act. Now, you see the definition there in the lower right corner. The Occupational Safety and Health Act of 1970, so this goes back quite a ways, is often referred to as the OSH Act. Okay, but most of the time, I'm going to just refer to it as OSHA or the Act. That's a federal law. Okay, so it applies to all workplaces, both private sector and government sectors. It's a federal law that is intended to ensure the safety and the healthful working conditions for the worker. Okay, so if you go back over to the bullets to the left there, the employer's responsibilities are quite a bit. On the next slide, or maybe it's 2 slides forward, you'll see there's a long laundry list of things. Okay, but basically, the employer has a responsibility to provide a workplace free of serious recognized hazards, as it says there in bullet number 1, and to comply with the Act, with the OSHA requirements, okay? Adopt a safety and health program, but also look at that last bullet, to comply with the drug and alcohol testing policy program that may be covered under the OSHA regulations, certainly federal regulations like DOT, and state law requirements. Now, we talk a lot about DOT drug and alcohol testing regulations, and for a good reason. They affect a large portion of the percentage of employers that conduct drug testing. There's also language in the OSHA regulations that pertains to drug testing and under what circumstances employers can test or should test or could consider testing, especially as it pertains to accidents. That doesn't mean that the OSHA regulations prohibit testing or dictate only when you can test, because I'm also referring to state laws. There are many state laws that either incentivize employers to conduct drug testing or that regulate how drug testing is conducted. In many cases, those state laws will defer to the federal regulations. And when they do that, they're not necessarily talking about OSHA regulations. They're usually talking about SAMHSA, the Substance Abuse and Mental Health Services Administration, Part 40, or sometimes they'll refer to the DOT regulations. If the law is really old, it refers to the NIDA regulations. That's back in the day when NIDA was the federal agency that we were all working to comply with. But nowadays it's SAMHSA. And many of these state laws will defer to the SAMHSA regulations, or Part 40, as it pertains to how to do drug testing. Not necessarily when to do it, pre-employment, post-hire, or who to test, job applicants or employees, but how to conduct the test. And so that's a big part of a workplace safety program, of course, okay? And as I mentioned, there's a lot in the on the OSHA website that you can find pertaining to what employers must do, the responsibilities that they have, but also the rights that workers have. Now, one of the things I didn't put in the bullets here, but because there were just so many of them, but individuals have a right to be trained and informed and educated on these rights and workplace safety and the avoidance of safety hazards, et cetera, in the best language that they understand. That's not a political thing. It's just, to make sure that everybody who's affected by your program understands what your program requires or offers them in terms of right. Like look at the second bullet there. Workers have the right to raise a safety or health concern with an employer or with OSHA directly without being retaliated against. Okay, that's one of the rights. It's there in the OSHA regulations, something that individuals should be trained on or educated about. But it really has to do with the well-being and the health and safety of the worker in the workplace, and that there's nothing in your work environment that threatens their ability to safely perform their job. So there's a lot there. I won't go through all of it here. As I mentioned at the beginning, I'm going to kind of breeze past some of these things, but we always show you, where you can find the information. And as I mentioned, you're going to have a link to the recording of this presentation. So What do employers need? Well, always a well-written compliant policy. Compliant with what? Well, compliant with perhaps the OSHA regulations, certainly, compliant with any local, state, or municipal requirements that apply, but the policy needs to be in writing, available to share with employees, possibly even job applicants, depending on the circumstances and the laws that apply to you. And leadership from management, participation from workers, and sort of a systematic approach to finding and fixing problems, hazards, okay? So let's go through those one by one. So management leadership, this basically is saying that as a company, your leadership, your management leadership is committed to providing a safe work environment. And so whatever that requires, given your workplace or your work environment, you're committed to doing that. And then involving your workers into that process. So as the bullet says there under worker participation, tap into workers' collective experiences, knowledge, and insights to find solutions to safety and health challenges, okay? That basically means, sometimes they're the ones who are gonna know best where the problems are, and they'll be able to highlight this for you. Make it part of your program that workers can come forward and share that kind of information, or ask for problems to be fixed, and then find the problems and fix them. And some of them may be dangerous hazards that are just sort of popping up out of nowhere. That gets fixed immediately, it goes away. But it could be something that's more long-term in how processes work, how employees do certain things. That again is something that can be identified, and then through participation between management and workers, coming up with a solution to the problem. Now, this next slide is kind of a lot of things, and I'm going to go from left to right, left to right, left to right. Okay, so where? Consider all the locations, the potential work environments within your company. It could be at a major plant, or it could be at an offsite facility, or it could be at a temporary workplace where you're sending workers. But you look at all these locations and the potential impact on the budget, on logistics, as it says there, and what it would take to fix the problem, and why you would want to do that, right? And I'm going to talk about that in more detail here in a second. When certain testing will occur and how often it will occur, how the testing will be conducted, and determining what services need to be coordinated. So that's a big part. A lot of the rest of this presentation will have to do with the what part of it, and then who it's going to apply to. And so if you think back, I mean, oftentimes, when I'm doing a drug testing webinar or presentation, I'm talking about the components of your drug-free workplace policy. Very, very similar when we're talking about your occupational health policy. It's in writing. It's something that employees can look at. In some cases, there are some state laws that require that employers share that with job applicants as well, that it gets posted in a place that's easily accessible, et cetera. But all of that comes together in sort of how you interact with your employees to make sure they know the things that you're doing to promote a safe work environment. Now, if you've attended any of our webinars in the past, you know that we love to do polls during the webinar presentation. So we're at poll number 1, and I'm going to turn it back over to Jessica, and this will give us a good feel for the things that you're doing and how the presentation today applies. And I'll make adjustments as I go along, depending on how these poll questions go. So Jessica, let's go to poll question number 1.
Absolutely. Thanks, Bill. So our first poll question today is, if your company conducts occupational health exams of some sort, are they due to government requirements or by company choice? And so your options are going to be, I'm going to go ahead and launch it so you can answer away with me, but um, your options are to comply with DOT requirements, to comply with OSHA requirements, to comply with other government regulations, a combination of government requirements, DOT, OSHA, et cetera, or company choice or other non-regulatory reason. And so if you would just give us a little bit of feedback here, that would be wonderful. So I'll be quiet while you think about it. Okay, it looks like our participation is slowing down, so I'll go ahead and close the poll and give you an opportunity to see the results. So 18% said to comply with DOT requirements, while 5% said for OSHA requirements, and another 5% said to comply with other government regulations. 55% said in combination with DOT, OSHA, etc., and 18% said company choice or other non-regulatory reason. And so I'm going to hide this and send it back to you, Bill.
Okay, that's really helpful. Thank you for filling out that poll. We're about to do another poll, so you're about to participate in another survey here just in 1 second, but that's very helpful to know what would drive or motivate your reason for having a program in place. So now we're going to talk about why occupational health services are critical, why they're imperative. And to help us get started with that, it would be great for us to know the answer to this question. So I'll turn it back over to Jessica for poll question number 2.
Thank you so much. So what aspects of occupational health screening do you currently include in your employee screening process? We'll launch those options here. Drug tests only, occupational health tests only, a combination of 1 and 2, none of the above, but we'd like to learn more. So if you would share with us, again, I'll give you some time to decide your answers. And these options were a little bit quicker to participate in, so we're slowing down, and we'll go ahead and close the poll and share the responses with you. And 27% said drug test only. No one is only doing occupational health testing that participated. 73% are doing a combination of the two, and that is our poll. Sending it back to you once again, Bill.
Okay, and that's kind of what I would have predicted, that the vast majority of you are doing drug tests and occupational health tests of some sort. And I wasn't surprised necessarily that some of you said none, because usually you'll attend a webinar like this because you either do drug testing or you do occupational health services or a combination of the two. So that's helpful. Thank you. Just as we thought, the vast majority, almost all of you are doing drug testing, and many, many of you combine it with occupational health exams as well. So let's move on to our first slide in this section. We're going to give you a little bit of background here. So, and I just updated this yesterday based on 2023, which was reported in 2024. So sometime this year, we'll get the 2024 data, but this is the latest that we have. So in 2023, there were just over 4,500 what the government considers preventable work-related deaths, so workplace fatalities, and just over 4 million work-related injuries that required medical attention or medical consultation. These are for 2023, okay? So according to OSHA, safety and health programs help businesses in lots of different ways. You see the results there. Now, every year, the current consulting group does a survey of the drug testing industry, which we released the results of those at the NDASA conference. We did that earlier this year, back in April, at the annual NDASA conference. We also conduct a survey of employer drug testing practices, and we'll be presenting those results at the SAPA conference coming up in October in Phoenix. And the number one reason that employers identify for conducting drug testing, for example, is safety, to improve safety in the workplace. And I point that out because, as you can see here, according to OSHA, a good safety health program helps prevent workplace injuries and illnesses. It reduced costs related to workers' compensation premiums. Okay, so a lot of it has to do with workplace accidents, with safety in the workplace, of course, right? But look at the last bullet there: increase productivity and enhance overall business operations. When workers are fit for the job that you've hired them to do, they're going to be better at doing that job. They're going to be more productive. When the workplace is safe and workers are not distracted by workplace hazards and accidents that are constantly going on, productivity improves. And so a good safety health program just makes the workplace a better place to work, and more productive, and I would argue a more profitable workplace. There are lots of accidents that occur, of course, and they get submitted. OSHA submissions by industry is a very interesting statistic. I just thought you'd find this interesting, right? So if you look at the right, from the 12 o'clock to about 4 o'clock on the dial there, You can see 28% submitted from the healthcare industry. And then below that, 21% from transportation and warehousing. So those two combined. 19% there at about 8 o'clock on the dial, retail trade. And just above it, manufacturing, 17%. And then very small percentages beyond that, right? So a lot of it from healthcare. That's easy to kind of imagine. Transportation, retail trade, and manufacturing. Those are the industries that have the highest percentages of OSHA submissions. Okay. Now, the benefits are a lot. And again, you can find this information at the OSHA website. You can find it in other locations as well. I've talked about it, dedicated to the health and well-being of employees, better hiring decisions. I think that's very helpful if you're conducting, I'm going to talk about fitness to work or return to duty fitness exams, return to work exams, etc. But this all contributes to hiring the right people for the job that you need them to do, right? So you hire somebody to lift heavy things, they've got to be able to lift heavy things without injuring themselves or without the likelihood of injuring themselves. And all of that factors in. If you're doing that type of occupational health screenings, that all factors in to making better hiring decisions. And that is going to reduce costs. I don't have the statistics in front of me, but I've done a presentation on the return on investment of employee screening, which drug testing to occupational health, and the cost that's involved on average of hiring new individuals, whether it's a management position or a line position. And it's interesting because the costs are significant. Just recruiting people or paying for a recruiter, depending on the type of job, the screening process, whether it's a pre-employment drug test or some other background screen or occupational health screenings, etc. But there's costs involved in hiring people. Avoiding claims from workers' comp is one of the ways in which pre-employment screening helps you to reduce costs, because you're hiring, again, people that are healthy and fit to do the job you're hiring them to do, and most likely not going to be impaired on the job as well from substance abuse. Different subject altogether a little bit, but I think it definitely ties in, okay? And then your program is going to focus on injury prevention, and that in part is tied to employee education for sure, okay? Now, there's 3 specific areas. I've mentioned them already, but I just want to focus again on it because we're going to launch into this here in a second. But the keeping your program up to date on a regular basis, I would say at least annually, as it relates to the OSHA regulations, to the DOT physicals requirement, as well as drug and alcohol testing, of course, and any state law requirements that apply to your industry. Now, there are some states that have industry-specific requirements, and so you need to know what those are if you're in one of those states, okay? I'll just mention an example from the world of drug testing. Illinois has a drug testing law that applies to public works contractors. If you have a public works contract with the state of Illinois, then you have to do the following types of drug and alcohol testing. And that's an example of an industry-specific law that in this case applies to drug testing, okay? So examples of occupational health services, there's lots. This is not an exhaustive list here, but DOT physicals, which I've mentioned, I'm going to get into that in a second. I'm going to go through all of these in more detail. But DOT physicals, fitness for duty evaluations, which can include return to duty, fitness for duty evaluations, audiograms, pulmonary function tests, which one of my favorites, ergonomics, x-rays, EKGs, vaccines, okay? And again, this is not an exhaustive list. You could get with somebody from Abbott and they'll take you through a long list of all the different occupational health services and exams and screenings that they provide. I've got a slide on that coming up towards the very end. But let's pause for a moment and let Jessica take us through poll question number 3.
Okay, great. All right, so we're ready for our third poll question. If you're currently performing occupational health tests, what types of tests do you include in your screening program? So let's go ahead and launch this poll, and we appreciate your feedback. Physical exams and or fitness tests, vaccines and blood clot services, a combination of all of the above, none of the above, but we'd like to learn more, and not currently performing occupational health testing. So you're Your choices can be made here. And then also, just so you know, if you're submitting questions, please continue to do so. And if we will try and work them into our Q&A at the end of the presentation, even if your question has something to do with something recently, we'll go back and discuss that at that time.
Yeah, and let me add to this one that if you're tempted to choose number 4, none of the above, would like to learn more, I promise you, you're not going to get a sales call from Current Consulting Group. You may end up on our Christmas card or Hanukkah card list at the end of the year, but we won't have a salesperson contact you. But we'd like to know just sort of the interest level among those who maybe aren't doing any of these things.
Absolutely. Thank you for that, Bill. All right, so it looks like we're slowing down, and I'm going to go ahead and share the results of this poll. 10% said physical exams. No one is doing vaccines only, but 62% are doing a combination of the above services. 17% are saying none of the above, but they'd like to learn more. And 10% said not currently performing occupational health testing. And so with that, I'm going to go ahead and hide these results and turn it back to you, Bill. But before I do, I can answer one of the questions that was submitted about we will be sending out a recording of this presentation. So if there is a slide we went by quickly that you want to see again, you will get access to the recording of this webinar presentation so you can spend more time with those slides. And so with that, I'll send it back to you, Bill.
Okay, thank you, Jessica, and thank you, audience, for your participation in these polls. I just find it really valuable as a presenter to kind of get a feel for where you're at with these things. And again, I would have predicted that most of you were doing a combination, and that was the highest percentage. So thank you for sharing that with us. So let's talk about each one of the things that I highlighted earlier, one by one. DOT physicals, for example. So if you have drivers of commercial motor vehicles, CMVs, that fall under the Federal Motor Carrier Safety Administration regulations, then in addition to drug and alcohol testing, you're likely already conducting or having DOT physicals done. It's intended, as that second bullet shows there, to make sure that the person's not just physically, but mentally and emotionally fit to operate a commercial motor vehicle. So if you fall under the DOT regulations, you're probably already familiar with the DOT physicals requirement. If you're not, get familiar with them, okay? Like, for example, you should know that only a certified medical examiner is authorized to administer a DOT physical, okay? And then that second bullet, a DOT physical is required when a driver operates a CMV across state lines. And then within state lines, it may be something that falls under specific state regulations, okay? There is a national registry for certified medical examiners, so that the list of those professionals is available, but the physical can only be done by a certified medical examiner, okay? And it includes a lot of different things. We don't have to go through all of them, one by one and talk about them, but just want to make sure when you go back over these slides later, if you're not familiar with the DOT physicals requirement, that you pause on this, take a look. You can find this information at the FMCSA website as well. But this is, if you see the highlighted or bold lettering in the paragraph there, this is the purpose of the DOT physical is to check the individual's vital signs, review medical history, and perform a required hands-on physical examination that is related to all of the things you see in the bullets there below. Again, the idea is to hire someone who is physically and mentally capable of doing the job that you're hiring them to do, which in this case with the DOT physical is to operate a commercial motor vehicle. The fact that somebody has a commercial driver's license does not necessarily mean that they're fit to operate a commercial motor vehicle. That has to be determined via the DOT physical process. Now, nowadays, there's a lot of talk about fitness for duty. I love this subject because you have a number of states that have passed, most states, not all, but most states have passed some form of a marijuana legalization law. And in some cases, Colorado is a good example, the employer cannot act solely on the result of a positive drug test for marijuana. There has to be some other evidence or proof that the individual was impaired in addition to the drug test, which doesn't legally or scientifically prove that someone's impaired, so that the employer can justify some type of adverse employment action if that's what the employer wants to do. Well, what we're seeing now just in the world of drug testing, but beyond that is fitness for duty evaluations that will, or fitness to work, or fit to work, right there in the title of our presentation today. So this is intended again to make sure that fitness for duty evaluations are intended to show that the individual can safely perform the job that you're hiring them to do, and then possibly return to work after serious illness or injury to do the job that they're coming back to do. Okay, we sometimes call those return to work exams. Very important though, especially in this period of time in which employers in many cases have to have some type of fitness for duty or fit to work evaluation to go along with a drug test result outside of the DOT regulations in states that have legalized marijuana. Audiograms, if you've ever done one of these, you know how they work. You hear a ping in one ear and then in the other ear, and it, kind of moves around in your head. And they're really interesting, and I've had these done as well. But there are a lot of workers in the United States that are exposed to potentially damaging noises. Now, OSHA requires, look at the second bullet, I'm just going to read. OSHA requires employers to implement a hearing conservation program when noise exposure is at or above 85 decibels averaged over 8 working hours. So I just did a little bit of research for this slide, and I found that the volume at a typical rock concert is somewhere between 90 and 120 decibels. Could be higher even. It was probably even higher than that at Black Sabbath's farewell concert in England over the weekend, right? Or this past week if you were tuned into that news, okay? But look at there in the gray box. Exposure to sounds above 85 decibels can be harmful to hearing, and prolonged exposure to levels above 115 decibels can cause immediate damage. I just thought that was interesting because we've all been to concerts and performances where the music was really, really loud, and there's the potential for hearing loss, and hearing damage. So anyways, audiograms, that's one part of it. The other one I find very interesting that I've also participated in are pulmonary function tests. So if you've ever had any kind of major surgery, usually they'll subject you to some type of a PFT, a pulmonary function test. And I've been through those when I've had surgery. And you see the picture of the booth there on the right. It's a little bit small, but I've never done one of these where I've gone into the booth and have blown into the tubes and had my lung capacity and airflow measured that way. But I have used the ones where they've come to the hospital bed and done it that way. And then I've actually been sent home from surgery with that little device in the lower right corner, which is something that you can continue to use. Just beside the point, there are lots of different ways to do pulmonary function tests and actually to work on your lung capacity and your airflow. And so it's usually with a spirometer, which is what you see there, those devices there, and it's called a spirometry test. And it can be a really important and helpful part of a physical exam. And there's a little bit more here, as you see. There are certain industries where maybe it's more critical, like in coal mines or graphite factories. It could be related to allergies that the individual has, respiratory infections, which sometimes come and go, and an injury, possibly causing difficulty in breathing. Ergonomics, not going to spend a lot of time on this, but it's important that we're, as you see there, this is kind of the trend now to have a desk that you stand at. I don't have such a desk, so I go to a chiropractor to get adjustments regularly, but it probably would be helpful. But that could be part of a physical exam or an occupational health program as well. And then x-rays and EKGs, depending on the circumstances, as well as a variety of vaccines, which can be available through a workplace occupational health program. So, sometimes that's the case where you work at a company and they offer flu vaccines, for example, and other types of vaccines. So that could be part of the program at where you work as well. There's lots and lots of stuff, and I don't mean to glaze over it, these last several slides, but there's a lot to consider, and that's why you really need help. I mean, coming up with your program is something that, and I'll just give a shout out to Abbott as the sponsor of our webinar today. That's something that they're good at. They have professionals who do this, and I wouldn't necessarily want to figure it out myself for my company. It's great to be able to turn to professionals who know this business and can offer good advice on putting a program together. So what I want to do now is pivot a little bit to the process. Okay, we've decided how we're going to do the tests or what tests we're going to do, who they're going to apply to, etc. But what technology are we going to do? How are we going to process? And for many, many years, it was a paper-based service, right? And there are a lot of challenges with that. So we've got 2 more poll questions. Let's do poll question number 4, because that's going to lead into my discussion about paperless versus digital or electronic services. So go ahead, Jessica, poll number 4.
Wonderful. Thank you, Bill. Are you processing occupational health exams electronically, or do you fill out paper forms? And so let's go ahead and get those options up here for you to participate. And your options are electronically, paper forms, a combination of both electronic and paper, or not applicable. It looks like we're slowing down with this one, so we'll go ahead and share the results. And 20% said electronically, 16% said paper forms, 44% said a combination of electronic and paper, and 20% said not applicable. So back to you, Bill.
Thank you. That is really interesting. 20% electronically, 16% paper, but 44% of you, a plurality, a combination of both. So let's talk about this for a minute, okay? Because if you're doing everything solely with a paper process, a paper-based process, or you're in the process of converting from paper to electronic, there's challenges that are associated with the paper-based service, right? It could take longer to get results processed. Could take longer. It could take longer to find to get the result. Could take longer to inform the employer of the result. And all of this is, in a way, costing money, of course, right? Because time is money in business. But it also may be delaying the employer's ability to make certain decisions. Maybe it's a hiring decision or a decision about bringing somebody back into the workplace after a serious injury or illness, okay? So look at that second bullet there. Due in part to these challenges, occupational health services have experienced inconsistent levels of digitation. Did I say that right? Digitization, I'm sorry. I practiced that earlier today too, so I wouldn't mess up on it, with a resulting impact in overall efficiency, quality, and experiences. So the impact of paper-based processes, turnaround time, accuracy and quality of the results, visibility in the timeline of results, I'll talk about that, and challenges into productivity, which I talked about there. So made lots of great strides when it comes to the digitalization of this process, okay? The paper process is it has inherent challenges, okay, and I mentioned that, but it's basically all about getting the right result to the right person at the right time. And the paper-based process is, by its nature, manual. It's a very manual process, and that can impact in a negative way turnaround times. For example, the effort to scan and email documents, manage and follow up on faxes, for example, and potentially field phone calls tied to lost or misplaced documents. That delays your ability as an employer or as a provider to report a complete and timely result. If you're not dealing with some type of wizard-driven software that produces consistency in the process, in the results, in the delivery of results, then a paper-based process can interfere with that ability to do that. And then the lack of order in the visibility, that also can create a negative impact for companies, employers that do this, or for their providers. It's the inability to plan and track exam results, okay? So some of you, I know it was I think it was 16% still relying on paper forms. You're probably dealing with all of these issues. Maybe you've just gotten used to it. It's not a big deal, or you don't think it's a big deal. But that a more electronic way of going about this is just going to make your lives a lot easier. Okay, and so let's sort of transition now to the digitally enabled services and what kind of positive impact they would have. And you guessed it, our final poll is going to take us into this section. So Jessica, poll number 5.
Great. Okay. So poll number 5, how important is it to you to be able to perform occupational health services electronically? So we'll give you an opportunity to share with us if it's very important, somewhat important, not important, I'm not sure, I need to learn more. So take a shot with all of these. Okay, and we're slowing down. So we'll go ahead and share the results. 72% said very important, 16% said somewhat important, 4% said not important, and 8% said I'm not sure, I need to learn more. So we'll hide this and send it back to you, Bill.
Of course, 88% of you said very important or somewhat important. That's very helpful. 4%, a very small percentage, not really important to you. You're happy with your paper-based process. 8%, not sure, like to learn more. That's helpful also. So thank you for sharing that. Very interesting that so many of you, 72%, said this is very important to you. It's kind of like, you know, how we do everything in life now, right? If I want to buy some vitamin C, I can take the time to drive to Target or Walmart and look for it, or this local CVS store, depending on what kind of pharmacies you have where you live. Or I can just go online and order it from Amazon, and it will likely be here before the end of the day. Now, I'm not plugging Amazon, of course, but you know, it's how we do things now. We do everything sort of electronically in a cloud-based format. So let me share something very important here. When we talk about digitally enabled services, Abbott was very kind in sharing some information, some data from their 2024 services in the eScreen in-network clinics for Abbott's national account clients. So these are companies, national account clients, okay, typically bigger companies using the eScreen in-network clinics, okay? So the percentage of results with turnaround time within 4 hours, okay? So you can see that, right? 95.5% said that they're able to get results within 4 hours. And a small percentage of the non-electronic, the paper-based, only 4% of those who relied on paper-based OHS were able to get their results within 4 hours. That's significant, okay? That's the difference between making a decision today and making a decision in the day or two. And so that, and making sure that the information you're getting is accurate. It's timely, it's fast, but it's also accurate because the system is consistent in how it processes information. The information goes into the software and it's processed electronically. Now, another area is the percentage of results verified within 1 business day. So digitally enabled OHS, a very high percentage. I'm not sure if let me look at my notes to see if I wrote that down. Yeah, 91.6%. That should be right there for the digitally enabled OHS in terms of verifying results within 1 business day. And for the paper process, about 48.5%. So a good, strong percentage on the paper process, right, 48.5%. But I can do better with the digitally enabled process, where I'm above 90%. Okay, so you might have questions about that, and if you do, let me know. I'm happy to address them, or I can get with Abbott and find out more information and then get back to you on that. But there's a lot to process there. If you're still doing it through the sort of manual paper process, you want to look at it, the digitally enabled process. It's just faster, it's more accurate, more consistent, very reliable, and you get results, as I showed on this slide and on this previous slide, faster. Turnaround time just significantly faster. 95% plus getting a result within 4 hours versus only 4.5% through the paper process. Okay, so we're kind of starting to come in for a landing here. So please, again, feel free to submit questions. Happy to address any questions that you have about anything we've talked about today, or it could be something related to, but not necessarily in today's presentation. Happy to entertain those questions. If we run out of time or I'm not sure on the answer, I won't make something up. I'll just let you know. We'll research it and then we'll get an answer for you. Okay, so let's talk about available solutions to facilitate performing occupational health services electronically. And for this, it's going to be a review of a few things that we've talked about, right? The utilization of software applications simplifies the OC Health screening process in all of these different ways you see in the various bullets there, okay? But it's a protocol-driven workflow that guides you through this process step by step so that you're getting a completion of results and reporting in a very timely manner. It reduces the potential of inaccurate or incomplete forms or errors that need to be corrected, etc. And it standardizes the services that as a provider that you're offering to your clients or you as an employer, you can rely on it because it's always this way. When you go into that digitally enabled solution, it's always done this way. There's no human error in the process because it's being done digitally for you, okay? And then this is a little bit more of a shout out to Abbott here on this screen and the next one. Stay with me though, because the next slide I think is very important. This one's important too, okay, but very important. But the eScreen Occupational Health Services for pre and post-employment are available through a very extensive nationwide network of clinics. So that's key to the whole process, right? Because locally, regionally, you may be able to deal with a provider who within that region can take very good care of you, and that's a great way to go. But if you're a nationwide provider, you're dealing with lots of different states, different counties, etc., you really owe it to yourself to look at a provider like Abbott with the eScreen Occupational Health Network that has clinics all over the country. That just makes the process easier. You don't have to wait for them to try to find somebody who can do this for you. And again, that second paragraph is important. Their electronic platform simplifies the entire process, right? It's like I said earlier, it's a step-by-step completion of results of the documentation and reporting. That just makes your life easier. It's just, you know, I used to tell my employees early on when I started the company years ago that our job as drug testing consultants is to help our clients, which are the DERs and the HR managers and stuff within companies. It's to help them get home in time for dinner by eliminating problems that used to take them a long time to solve, but we're giving them assistance that solves the problems and streamlines what they do every day dealing with, in our case, drug testing, okay? That's what this does for you. It just streamlines the process, takes so much that manual, time-consuming element of it out of the equation, and just puts you in a position to be able to do things faster. That last bullet, reducing potential errors, delivering fast results completed correctly the first time and not having to go back and complete errors. And this is one of the things I referred to this earlier in the presentation. This is just a partial list of available OC Health services from Abbott. And some of them are things I talked about, like you see the first bullet, audiograms or DOT physicals. Could be DOT, drug and alcohol testing, of course. Abbott's very famous in the industry for that. And a whole host of other things. I'll just pause on this for a second. Again, you know, one of the questions that we ask in our annual employer survey is how important is it to you as an employer to be able to purchase your drug testing from the same provider that you get your background screens from or your occupational health services from? And it's always a very high percentage. I don't have it in front of me, but it's always a very high percentage that says that they would just prefer to deal with one vendor who can do all of these things from the DOT drug test to the DOT physical and any other things in between. So this list of services is important. If you go to, if you're looking for an occupational health services, and I'm not selling Abbott or eScreen, that's not my job, right? But you do want to work with a company that has that kind of reputation, but that has this wide variety of services. There's just no replacement for that. It's so that you don't have to sort of jump around to get part of it here and part of it there. You just deal with one provider who can do all of these things for you. And also using an electronic format, a digitized process of entering results and getting those results into the employer's hands as fast and consistently as possible. Just makes everybody's life easier. So, gone on a little bit there, but thank you for being part of today's presentation, for your participation in the polls. That was very helpful. And now I'm going to just pause and take any questions that you have. And like I said, ask me any question. If I don't know the answer, we will research it and get you a response. And if we run out of time, we'll get to everything that's been submitted. You'll get an answer to your question, I promise. So Jessica, what do we have for questions?
Sure, thanks, Bill. So let's start off with one of our first questions for today is kind of talking about the potential cost. We talked about paper documentation and digital. We had the poll about it as well. But what can people expect with the potential costs of moving from paper documentation with services to digital?
Yeah, so two-part answer to that. One is, for specific costs, I would refer you to the good people at Abbott. They'll be able to take a look specifically at what you're doing, what you want to do, the volume that you're doing in terms of the types of exams, and then they'll be able to give you a specific, price for what you do, what you need, and how you need it done. But I will say this, that, and the same thing applies to drug testing when we talk to employers about lab-based testing versus rapid result testing, which I'm a fan of both of them. I'm 36 plus years of promoting drug testing in the United States, and I'm a proponent of urine testing, oral fluid testing, hair testing, as well as lab-based testing and rapid result testing. On record, times 1,000, advocating for good, responsible, legally compliant drug testing programs. But what I always tell employers is, if you're looking at the cost of a rapid result oral fluid program versus a lab-based urine program, both great options, right? But you can't look at just the cost of the test. You have to look at the time that it saves you to do the one over the other. And then depending on what your needs are, you go with the one that, in terms of hard dollars, the cost of the test, and the soft dollars, the savings in time that leads to increased productivity, and you go with the one that gives you the best return on investment. So as you talk to the folks at Abbott, they'll be able to take down specific information about your program or what you want your program to be. You can compare a paper-based with an electronic-based, but you're going to find that almost in every case that digital process just makes it faster, more efficient, the results more accurate and consistently accurate, and the resulting, the results getting into the right people at the right time. You're just going to find that to be valuable in and of itself, but the time that it saves in terms of going, people within your company having to spend time on the phone, tracking down a result, fixing an error, going back and looking at paper forms to see what did we do wrong, did we put something in, that's all time that costs money. And so going forward, everything's going to become digitized. There's, we're just heading in that direction. So the sooner you go that direction, the more you'll be ahead of the curve on that particular issue. But I assure you that if you look at the overall return on investment, just like with, rapid testing versus lab-based testing, which are both good, okay? Again, I'm not taking a position one way or the other, but you just find that depending on your circumstances, one just makes more sense, right? Because the time that you save, the productivity that you gain, and it just, from a soft dollar aspect, factored into your return on investment calculations, just makes more sense. And the same is very, very true with a paper-based product versus an electronic or digitized service.
Okay, great. Thanks for that. Another question that kind of, I think, will follow up to that in a sense. The question is, how does one go about being able to offer those other services like background and physicals when you're in the private sector? So this might be just another recommendation of where this people could go to expand their offerings.
Yeah, and that's an important question, and I want to answer it two different ways. One, of course, I'm going to suggest maybe talk to the folks at Abbott. They'd be able to give you very specific answers. But to whoever asked that question, I think one of the things that we're looking at as a sort of globally as an employee screening industry, not just drug testing, but background checks and occupational health services, is where are employers taking us? Where's the market taking us in terms of the demand of certain types of services? And whereas, not 30 years ago, but more toward maybe 20 years ago, um, we were a very drug testing driven industry. We call it the drug testing industry. That's just not the case anymore. And I was on a call with a client today talking about, different ways to grow their business and some suggestions that I had. And I just said, the days of relying on drug testing revenue alone to grow your business, not necessarily to maintain it. You can maintain where you're at, but to grow it, it's going to require you to be good at and to offer occupational health services, a wide variety, like we talked about in today's presentation. That's just the future. That's the direction that we're going in. That's where employers are taking us. That's where the market's taking us. Some of it's kind of, as I alluded to earlier, the related to the legalization of marijuana. Some of it's having to do with the economy and employers looking for ways to do things more efficiently so they can cut costs and streamline operations and improve profitability within the scope of what they do, just doing it more efficiently and effectively. And making sure, like I said before, that you're hiring the right person for the right job who's physically and mentally capable of doing the thing that you're employing that person to do. Otherwise, you've spent the money to hire, that's a waste because the person didn't work out, and potentially bringing somebody back into a situation where they just can't, continue to perform that job. And there's money spent as a company going through that entire process. And the occupational health services that we've talked about today, specific ones, depending on the circumstance, help to eliminate those errors and the costs and time expenses that are associated with not doing it. And so as an industry, I see us going more in that direction, in the same way that I see, the way we do drug testing changing, but the sort of the overall package of services that work together, drug testing, background screens, occupational health exams, et cetera, working together to give an employer the full spectrum of what they need to know when they hire somebody, when they bring somebody back after an injury or an accident, et cetera. I think we're just definitely going in that direction. It'll have a big impact on how services are provided and what employers demand from their providers.
Okay, thank you for that. We have just a minute left, and we had one more question. Maybe we can answer briefly, and then if someone has more questions about this later, then please reach out to us and we'll share more with you. But what about an employer's liability versus an employee's when it comes to workplace accidents caused by someone under the influence?
Well, so there are a lot of factors that come into that, and I know we only have a minute, so I'll make this very brief, but I would be happy to provide more information in answering that question. But first of all, look at the state laws that apply to you, because some of them have very specific language about liability in the event of an accident. Many states, most states have workers' comp regulations that allow employers to move to deny benefits if they have a positive drug test following an accident. That shifts the liability to the employer, to the employee, excuse me, and away from the employer. And then, of course, having some evidence that drugs may have played a role in the accident. There's lots of examples of that from, headline grabbing workplace accidents that ended up revealing that the worker who caused the accident and hurt or killed other people was under the influence of drugs at the time. And that helps protect the employer in those events. Maybe not entirely, but it does show that an employer who has a good screening program in place, either drugs and alcohol or some of the other things that we've talked about today, is making a good faith effort to have a safe working environment. And that will go a long way toward helping the employer in the event that something like that happens.
Okay, great. Thank you so much, Bill. And thank you all for joining us. And those of you who've stayed on a minute over to hear the end of that response, we appreciate you being with us today. We also want to again thank Abbott for sponsoring today's webinar presentation. On the next slide, we'll have contact information for Abbott should you want to reach out to them and to have them help you with some of those questions we had at the end or things that you've learned about today, they can be reached at marketing@escreen.com for more information. And then we also wanted to remind you that today's presentation was recorded and you will receive information on how to access that recording via email. For those who've attended the entire presentation today, you did qualify for continuing education from CCDAP, or excuse me, from HRCI and from SHRM, just those two organizations at this time. And we also will send you the continuing education codes for those two groups with the email and the recording. And so we want to thank you for your time today. We want to thank Bill for his expertise in going through all those slides with us. And of course, we want to thank Abbott one more time for their sponsorship of today's slide and our today's presentation. And that concludes today's presentation. Have a wonderful day.